have to take AMP 1 and 2, you're having to take medical law, pharmacology, transcultural competency. You do a 210 internship with a clinic to get your certification. So after you take the full year program, then you also have to take a nationwide testing exam. They give you about 2 hours to take it, and it has to be in a accredited facility to do that. This year was the first year for Walla Walla Community College to be accredited to do that exam. Otherwise, you have to go to Spokane or off to Tacoma. And then after you take your nationwide certification test, you also have to apply for the state certification, but you also have to have your certificate in order to do that. You have to submit your transcripts. There's the authorized job duties has grown as well as the title. You can now do phlebotomy, you're working in labs. It's not just taking care of patients and passing meds. You're also giving shots, taking blood, and working with patients in clinics. The different job sites are doctor's offices. You could be a receptionist, or you could actually be the person bringing the patients back, getting their vitals, asking what's going on, why they're in there for that visit, and doing the documentation. There's doctor's offices, and then there's medical clinics like a family practice where there's 4 doctors and 4 CMAs taking care of patients. You can work in the reception area where you're scheduling appointments, answering phones, and doing stuff like that, or with working with the patients. You can also work in labs, like doing a blood draw lab, or working in labs that do the testing on different specimens, as well as a blood bank. Any questions? Yeah.
What about like old, like if you've already been in the business for a while, do you have to go and get all this accreditation now, or does your past work experience apply?
So if you worked at like Tri-State, they have been grandfathered in, so that way you can still have that credential. You'd still have to apply for your Washington, but you wouldn't have to have the schooling because you've been working beyond job training. So places like that have been